Thank you, Mr. Chairman. And I just want to reiterate the feeling of all members of this committee about the urgency of this situation and the determination to get it right, whatever decision that we reach. I don't believe there's a single member of this committee that does not feel that this is the most urgent priority in front of us. Mr. Wilkie, I just had the pleasure of finishing Secretary Mattis's new book, and I know you're an admirer of him as well. And he reminded me of one of the lessons of the basic school, which is that time spent doing reconnaissance is almost never wasted time.
Absolutely.
And so I think that's what we are doing here. I would like to focus, if I could, for a moment on what I see as the strengths of the Chairman's hub proposal. First of all, I just want to ask up front, the hub proposal that is being suggested in the alternative, do you think that VA could make that work if that ended up being a decision at the end of the day?
And we've seen it work with homelessness, and that's why I referenced the speaker at the beginning of my remarks. What the hub proposal did, what the hub model did, was go out into the communities and find groups like Catholic Charities who have deep tentacles into all areas of a community and say, go out and help us find homeless veterans. I think the addition that General Bergman has made augments that by trying to find those groups, even small ones, that can be more creative when it comes to helping us find those veterans on the street. But yes, I think it's worked before, and I think it'll work again.
And I appreciate that. And I think it's important for people to know that this is actually already working in some communities in the country. So not everybody has an America Serves hub already, but I'm sure you're familiar with the America Serves program.
Yes, sir.
We are fortunate enough to have one in 3 counties of the roughly 10 counties of southwestern Pennsylvania. And it is, you mentioned Catholic Charities, this one is overseen by the Pittsburgh Mercy Health System, which is a offshoot of the Sisters of Mercy.
And one of the best in the country.
Definitely one of the best. And the program administrator of that is an artilleryman from the Pennsylvania National Guard. The team leader was an engineer in the Pennsylvania National Guard with deployments to the Middle East. The intake specialist served in the 1st and 23rd Infantry Division in Iraq from 2003 to 2004. The other intake specialist served as a military policewoman in the Army Reserves. The other intake specialist was an Air Force enlistee for 11 years with deployments to Iraq. And the overall head of it is a 10-year social worker with expertise in community health for Pittsburgh Mercy. This staff in Pittsburgh knows the community. They are veterans. They know mental health treatment. They already are coordinating with dozens of local groups all around our area. And from what they tell me, they could expand their reach beyond those 3 counties and serve a higher number of veterans if they had additional funding and support. So my question, I guess, is if we have hubs like this already in existence that already know the difference between a good provider and a bad provider, or I shouldn't even really say provider, but I guess recruiter of veterans, an agency that encounters veterans. I think we share the goal of going out and finding these people.
Absolutely.
It's often a conservative principle to shift decision-making down to the lowest level. And so from where I'm sitting, why is the PA Serves network not a better decision-maker and better distributor of funds than someone in your office in Washington, D.C.?
Well, I don't think that there's a yes and no answer to that. I do think that as stewards of the federal dollar, we do have to go out and investigate and determine who is good and who is not. And that's just routine cost of doing business. And certainly and you and I know, I was just in Pittsburgh. What's going on in Pittsburgh is a model for the country. It's a model for veterans, and I think that an organization like that would be at the top of the list.
Thank you, Mr. Chairman. One last question. Dr. Stone, I did ask you last week about the vacancies in vet centers and mental health providers. Do you have that number?
I do. At this time, we have over 24,000 providers. Our vacancy rate is just over 2,400, or just over 10%.
2,400 on the mental health provider.
Right.
Would that include, that would be like docs, nurses, social workers, all
These
inclusive?
are mental health providers, so they're psychiatrists, psychologists, psychiatric social workers.
Got it. Okay.
So,
on the vet center side?
The Vet Center side I don't have in front of me, and I will promise you I will get that.
Okay, thank you, Mr. Chairman.
If I could just add one other thing, the administrative overhead as part of this bill is about 20 employees in central office, but specifically their job would be to seek those organizations like you listed with relationships in the community that could act in the hub manner in order to distribute throughout the community. But there is not a large administrative overhead anticipated within central office.
Thank you. Mr. Chairman, I yield back.